Hello and welcome to week 11 of Class Power and Social Inequality. Today, we are going to look at the relationship between class power and the social construction of health. So let's jump in. Um, Health is socially constructed in the United States. And what I mean when I say that is that it means health and illness mean different things in different contexts, depending on who you're talking about, who you're talking to, the conditions under which the person that you are referring to is living or existing. All of those things religious identity, cultural affiliations, all of those things impact whether or not a person is deemed to be healthy or they are deemed to be ill. If health and by extension illness are socially constructed, then there are a set of social determinants of health that we can look at to help us predict the health outcomes of an individual. And so those social determinants of health are economics, environment, food, education, healthcare, and social circumstances. So let's extrapolate out a little bit further and talk about what that means. Let's talk about environment first. Where do you live? Is there a lot of air pollution or land pollution in those areas? If you think about the people who have been living in Flint, Michigan for the last decade or two that are being slowly poisoned by lead in the water, that's an environmental issue that is causing health outcome differences by geographic location. And because geographic location, residential areas and neighborhoods we know are racialized and class segregated, then we're also talking about poor Black people being poisoned because of where they live, which is based on where they can afford to live and having long term negative impacts on their health, including things like cancer. Um, your neighborhood can also determine what kind of food you have access to. Are there grocery stores or gardens where you can access healthy produce, or are there only fast food restaurants and convenience stores that sell pre-packaged food full of preservatives? Those foods are cheaper and easier to access for poor people living in those neighborhoods that don't have grocery stores. But that is also then impacting their long term health outcomes relative to people who don't live in food deserts. For the first 2 years that I was teaching here, I lived down in Germantown, a neighborhood in Philadelphia that did not have a local healthy grocery store and instead just had fast food restaurants and convenience stores in the immediate 2 mile radius around me. And so because I worked in a predominantly white area, I was able to do my grocery shopping in that predominantly white area on my way home to the predominantly Black area where I lived. And that um, allows me to escape potential negative health outcomes, but only because I have access to these white neighborhoods. Um, if you think about education, it's not only literacy, but also access to resources, right? So, did you find out that you have a learning disability because you went to a college that had a lot of institutional supports for that, and you were able to graduate on time and do better at school than you had previously because perhaps you came from a school that didn't have those sorts of institutional supports for diagnosis um, and continued support post diagnosis. When for most of my childhood life, I dealt with generalized anxiety disorder, but I didn't realize, and my family didn't realize, that that's what I was suffering from because we didn't have a lot of literacy around psychology or psychologists or therapy. It wasn't until I went to college at Vassar, a school with a lot of institutional supports and resources to do those sorts of things, that I was introduced to the idea of therapy, and I was diagnosed with generalized anxiety disorder. And had I not been, I probably would have um, more negative health outcomes, but also just life chances without access to that necessary treatment. Okay, if health and illness are socially constructed, then well being is also socially constructed. And in this model of well being, you can see that it's really just the flip side of the chart that we just saw. In order to be well in the United States, you have to have access to healthy living conditions, healthy food, preventative health care, positive social interactions, and lack of stressors. Now, why is it important to understand in United States culture that health and illness are socially constructed? Well, it's important because health and illness and wellness as well in the United States are businesses. They generate profits. And if they generate profits, then they will continue to perpetuate and extend out the disparities in health outcomes across groups. Okay, let's look at a couple of things. So look at these charts. You can see that healthcare industries and hospitals specifically profit greatly from the treatment of American citizens. Um, and this is sort of the starting place for the social construction of health and social conditions which dictate who can be healthy or not in the United States. I mean, for God's sakes, we just saw the president get experimental treatments and the most unique treatments for his infection of COVID 19 in just 3 days, whereas most people will never get that treatment. We hear stories about people being turned away at hospital doors because their symptoms were not severe enough, only to die at home the next day. Well, those things happen because the people who died at home were not going to be able to provide the same kind of profit margins for the hospitals and the healthcare industry as those rich, wealthy people around the president who are being treated right now. Um, just to belabor that point, I want to do that in this case. One of the reasons that health and wellness are such big business in the United States is because the cost of a routine doctor's visit is in some cases 5 times in the case of France, or even 10 times in the case of other countries, more expensive. And if you have to pay $175 to do a routine preventative checkup, and most people don't have a disposable income that allows for that, then you are going to see an uptick in people who are sort of quote unquote ill, and a constructing of why people are ill or healthy comparatively. So, for example, when people get sick and die of COVID, when those stories first started coming out, the discussions were, oh, well, that person was obese, or they had a pre existing condition, or they had this, or they had that, as a way to explain their illness and simultaneously define others as healthy and unlikely to be infected. Doing that um, changes how people think about what healthy and ill is, particularly around this disease, but we do that around lots of diseases. Uh, so, a lot of the public discourse the last couple of years, especially about mental health, has been encouraging people to engage in self care as a way to deal with the general stressors of life, but also improve their overall physical, emotional, and mental health. But self care is not free, although you will find lots of articles online about how self care doesn't have to cost you anything. You don't have to get expensive massages or facials or take yourself out to dinner. You can just read a book, or you can meditate, or you can do some yoga, as though those things are completely free, that they don't cost you time or materials or space that you might not otherwise have. So when we talk about the social construction of health and illness, and by extension, the business of self-care, what we're talking about is a construction of responsibility and accountability. And we try to, in the United States, make health and illness and self care a matter of individual accountability rather than a result of existing social inequalities built into our American economic structure. Let's look at this chart. I like it because it shows that health is constructed around access to health care in the United States. We can see here that insurance greatly improves access to health care, and it reduces disparities by race and ethnicity in access to health care. And yet, because health insurance is directly tied to employment in the United States, which is different than almost every other country in the world, insurance and therefore access to healthcare and therefore a healthy life are not assured for most people. And that group of most people continues to expand as the middle class dissipates and as more people become a part of the working poor, especially working for organizations that do not offer health care as part of the employment package. Um, all of this means that the most vulnerable of us in American society are left out of healthy living. You can see here that racial minorities, Black, Hispanic, Native American, Pacific Islander, much more likely to have foregone a doctor's appointment in the year 2018 because of the cost compared to white and Asian people. And if you look at incidents of disease, like heart disease, diabetes, certain types of cancers, white and Asian people in the United States are much more less likely to have to deal with those sorts of diagnoses than Black, Latinx, Native American, and Pacific Islander folks in the United States. And that is a direct connection between racial and ethnic identities, class status, employment status, and therefore access to healthcare or not. All right, I'm going to leave you with an interesting, but maybe a little bit depressing active learning exercise for today. What I'd like you to do is jump online and do a little bit of research about the cost of individual insurance plans versus family plans per month. Come with a couple of options. Just jot down what the company was, what the cost per month was, and if you can find what that includes, that would be great. Come to discussion with your findings, and we will talk about it then. Bye bye.